So our next session is focused on Health and Wellbeing Networks, communities taking ownership of their health. And our presenter today is Bruce Levett. And Bruce, we're very grateful that you've come to join us from beautiful Tasmania. We know the Sunshine Coast is beautiful, but Tasmania is also beautiful. And Bruce is the CEO of Consumers Tasmania, a not-for-profit community-based health consumer advocacy organisation. So we welcome you, Bruce, and look forward to hearing your story and what you've got to share with us today.
Thank you. Before we start, I'd just like to acknowledge that today we meet on Aboriginal land and to acknowledge the unbroken connection that Aboriginal people have to our country. We pay our respects to Aboriginal people here today, to elders past and present. We acknowledge that our First Nations people are displaced people. Their land was taken from them and they still suffer inequalities and racism today. So is, was, and always will be Aboriginal land. Now, I might need to work out how to drive all this. I think I'm up here on my own. So today I'll just briefly talk about who we are as Health Consumers Tasmania. I'll talk a little bit about me so that you know who I am. And then we'll talk about the journey that we've been on with the Health and Wellbeing Networks. We decided we needed to think about how we engaged with the community different in Tasmania. We needed a number of different approaches. So I'll take you through the journey that got us to the Health and Wellbeing Networks. So firstly, as you know, so we Health Consumers Tasmania, we like Health Consumers Queensland, but we're much younger, we're only 4 years old. So back in 2018, we spent 12 months thinking about the organisation, co-designing the organisation, and in 2019, we became incorporated. So I report to an independent board. I have 12 staff who are highly energetic, totally committed, and what I'm talking about today is the work that they've done. So that's important to acknowledge their great work. A little bit about me. So I was born in Padaway, which is Burnie. It's an industrial town on the northwest coast of Tasmania. I was educated and lived in Nipaluni, which is Hobart. And the first slide is a picture of out the back of our place. So we get a view of Canungi or Mount Wellington with snow in winter. I live there obviously with my partner and 2 children. So there's a slide there of my 2 kids. About 5 or 6 years ago, we spent some time in the Solomon Islands. So as a family, that was a really special experience for us to be there for over 12 months doing some aid work. A special place for me is that jetty. It's called Squeaking Point. So my grandparents had a place there. So growing up, every holiday was playing on that jetty in the water. And for me, it's something that I often look back to and I really associate with that place quite strongly. One of my passions is travel, cycling, bushwalking. So again, I like getting out, meeting people and just experiencing different cultures as well. The other thing to note is I don't have a health background. I've never, ever worked in health 2 or 4 years ago. So my perspective, my background is in economics, in numbers. So I've used that through business, through industry to think about things. So that's the skill base that I bring and also in international work. So to apply that to health gives me a completely different lens. And some people look at me and go, but where's the letters after your name? How come you haven't worked in health? But I look at health from a different perspective and it's a challenge for me. And if it's a challenge for me, it's an enormous challenge for many people in the community. So this is a heavy slide in terms of content. I'm just juggling stuff up here. So this is going back to first principles for us. So when COVID arrived, we like everyone stopped and we had to think about how we were doing consumer engagement. So in Tasmania, a lot of our committees that we were supporting with consumers, they stopped. The department in Tasmania really started to focus on how they could survive, and the community voice was sort of left out of that. So we went back to first principles and we really started to think about, well, what's the community actually telling us? So we already knew that access to healthcare is really, really hard. It's getting harder. And I think like here in Tasmania, for some people, it's actually impossible. It's actually, you can't get access to healthcare. The second thing we already knew was navigating the health system is really, really hard for people. It's really complex. The system is siloed. So for many people, even if you get access to healthcare, what happens next is really hard. Who do you go to talk to? And that siloed mentality isn't just from a community lens perspective, it's also from people in the system to understand how the health system works, even when you're in it, from what people have told me, is really, really hard. People also wanted to be treated within their communities when it's safe to do so. So that's an underlining message that we continually get. And people don't want to get sick. So we talk to a lot of people, my generation, maybe a bit younger, that you often hear the words, if only someone had told me, if only I knew, which is, you know, it's sort of code for, you know, that there was no preventative health for us growing up. That wasn't on the radar of the health system at all. There was a bit of slip, slop, slap. There was some good stuff that happened, but at the end of the day, preventative health wasn't a priority for the health system. When COVID arrived, it sharpened our thinking a bit more. So we learned that communities come together when under pressure and they mobilise themselves. They often don't rely on external people. They just come together. So we saw that really strongly. We also saw that prioritising health became more important. So for me, first time in my life, you sit down and watch the news and they talk about health. They wouldn't talk about economics or dollars or stuff like that. Prioritising health became acceptable. We also learned that the social impacts on our health became quite clear. So in Tasmania, there's a digital divide and they're talking about health literacy next door. When health moved online in Tasmania, a lot of people got left behind. A lot of people couldn't afford data. They didn't have phones. So it became harder. So for some people, it became easier, but it became harder. So that's an example where it became really obvious about other factors that influence our health. And also staying well is really a worthwhile thing to do. So we've, you know, 2020, 21, we saw the biggest preventative health strategy ever in Australia. We actually kept people well instead of letting them get sick and then fixing them. So for us, we thought about this. We thought about, you know, what does that mean for us as an organisation? So for us, so we realised that the community conversation had changed dramatically, but we also knew from our conversations with government that they were almost desperate to do things differently. They were looking for answers. There was an acknowledgement that maybe what was happening wasn't working the way it should. So COVID really gave a lot of people, gave us as an organisation, gave the community, it gave service providers permission to think about health differently. So we realised that the stakeholder culture had changed quite a bit, even though they may not admit it. There was momentum for some change. So for us as Health Consumers Tas, knowing that people wanted stuff happening in the community, we're Hobart-based, we're a small organisation, so we had to be out in the community. We had to get out there somehow. So for us, that was a different way of working. But we also challenged ourselves, well, how can we further empower the community to think about health and wellbeing differently? So that took us not away from committee work, because that's really important. Didn't take us away from chipping at, you know, the acute sector and all that sort of stuff, because that's really important. But we felt we needed to be in the community and we needed that grassroots driver to impact change, because without grassroots, you won't support, it's really hard to impact really deep change. So we sort of stumbled across a community by community approach. So what happened? Primary Health Tasmania, which is one of the primary networks, or the primary network in Tasmania, they came to us to do a health needs assessment of their community. So the Tasman, as you probably know, it's about a bit over an hour's drive from Hobart. It's quite an isolated community. It has Port Arthur, so it has a tourism focus, but not many of the dollars stay on the Tasman. They come and go. There's a really strong community that have gone there to get away from society. So there's a strong alternate culture down there as well. So there's a lot of people just being there because they can be there. It's an older population as well. And it's also a population that has had some fairly significant trauma over the last 20 or 30 years with the Port Arthur massacre. And then there was some Dunalley fires probably about 8 or 10 years ago. So as a community, they've gone through a lot. So Primary Health Tasmania wanted to understand what was happening in the community from a health perspective. So we said, yeah, look, happy to be involved. And we didn't quite put conditions on our involvement, but we said, if we're to be involved, we want the community to do it, not us. We want to be there long term because regional communities hate people coming and going. So we said, if you want us to do this work, we want to be there and we want to be there long term. And we want to really empower the community to take control of whatever they find. And, you know, the PHT were okay about that. They didn't quite know what that meant, but they were okay. And then from an outcomes perspective, we wanted to really support the community to co-design whatever they came up with. What solutions do they want? And at the end of the day, we want the community to decide how to spend money. Health money comes into the region, service providers come and go, but we wanted the community to control that and actually make those decisions instead of external people. So the picture there is from Cubed Coffee, so I'll give them a plug. It's at the entry point of the Tasman proper. So if you go to the Tasman and you walk, there's a famous a 3 Capes walk. You'll actually walk around the Cape in that frame on your left is where you'll walk. It's a beautiful place, but for us, we love this photo because it's really symbolic. So every day, the locals get up there, they put the frame where they want to put it, and then the tourists and the outsiders come and they take photos like that, or they'll take photos of what's inside the frame. So the community is actually telling tourists, today, this perspective is really important. Why don't you have a look at it? So for us, that's a really powerful bit of symbolism that we absolutely love. So in terms of the Tasman process, it might look complicated, but I can take you through this quite quickly. So the Tasmanian Health Services, they fund services down there. Primary Health Tas funds some services. So they're the organisations that control the dollars. They're the decision makers. And luckily, we sort of nudged our way in. So we became part of a 3-person group. So we could make sure that the community were part of that decision making. So that was really, really important for us. So Primary Health Tasmania, they did a desk environmental scan. It's important to know who's there. It's important to know what services people use and what services are available. They also ran a workshop where they got the service providers in a room like this, probably a bit bigger than this, but not much. There was about 20, 25 service providers turned up, GP. There were nurses, there were Royal Flying Doctor Service, there was Neighbourhood House, pharmacist. They all sat in a room and they had a bit of a chat about who did what. And we participated, so we were there. We could talk a bit about what we were learning from the community. But it was amazing, in a really tight, small community, those service providers didn't know each other. They actually didn't know what each other did. So the conversation was really about, oh, who are you? What do you do? Oh, okay. And it was at times it became a little bit awkward because, you know, someone would say, oh yeah, if we have this issue with a person, we refer them to this service. And there's quite, and people go, well, that service hasn't been here for 2 years. So what, you know, and you could see that the service providers were out of date in terms of what they were doing. So if they didn't know what they were doing, there's no way the community would know at all. So it was great. So from a social capital perspective, it was great just getting those people in the room and getting them to talk about their issues from a service perspective, which is really important. From our perspective, so we we leaned on Health Consumers Queensland, and they provided us with some training and support around kitchen tables. So what we did, we went and spoke to 3 people on the Tasman, talked about, hey, do you want to be involved? How would you like to do it? You know, go away, think about it. We're here to support, but off you go. It's just see what happens. There was probably COVID probably helped us because it slowed the process down because the community actually needed time to think about it. So we had timelines which wasn't actually the timelines of the community. So that made us stop and wait. We were forced to, but that actually worked in our favour. So those 3 people went and spoke to about 8 or 9 people. They were really keen to be involved. So we provided training to those 9 people on kitchen tables. They went off and they spoke to, they did 13 kitchen tables. They spoke to over 80 odd people, and they came back to us with what was important to them, which was really, really powerful. So we pulled that data together. We did that with the hosts. We fed that back to the people that participated, and then we closed that process by, we had a morning tea on the Tasman where we just said, hey, this is what you've told us. Great, let's celebrate. And for us, that was a really empowering, part of our process was just to keep the community together. What we found was a lot of those people who had been on that journey with us on the kitchen table work said, hey, our job's finished. We've given you some time. We've supported you. It's time to get some other people involved. So what they did was they then recruited more community people to do the next step, and they stepped back, which is not quite what we expected. But again, it was just the way the community wanted to do it. They wanted to come in, contribute, and then leave. So for us, that was really, really important to understand. What then happened, so with PHT, so we did this together. We got the service providers and the community around the room just to have a chat. We talked about what the community were saying, and they used their own voice and they did that themselves. And the service providers were going, yeah, we actually agree. This is actually what's going on. So it was, it was over dinner, quite a few people, really good, positive conversation. Nothing about, oh, you should do this or you're not doing this. It's just about, this is where we're at. These are our issues. How can we fix some of those issues? And it was a community that were pushing, but the service providers knew that they had to do something quite different as well. And then we now, this is where we're at now, and it's the co-design part of the work. So at the community and industry workshop, the service providers decided they needed to spend more time together to work better together. So they set up their own clinical working group, and we participate in that, and it's great. And they're actually doing some good work. The community formed, they call themselves the Tasman Voice for Health. They've recruited themselves, they've got their own chair, they've identified the issues, they've gone deeper on some of the issues, and they're pulling together, they're just doing it. So we're in the background, we just provide a bit of support now and again, but it's the community that's actually driving what they want. So both groups have come together, the clinical group and the Tasman Voices for Health group have come together once already to talk about information sharing, because that's a big issue. So we're doing some work around that, which is really good. And we'll be getting together in February to talk about after hours access, because 5:15, 5:30 on the Tasman, if you want health support, there's nowhere to go. So that'll be a harder issue to break. But I think if the community's there, they've got ideas on how that can work. So in terms of the issues that collectively we've looked at, so the 3 dots on your left, they've actually made progress in. So they're actually pulling together a directory and they're working out how to get that information out to the community. And it's just not a clinical directory, because that would only be a few lines down there. It's got allied health as well, but they're also interested in the social community services as well. So the walking clubs, the book clubs, all those sort of groups, because people want that sort of support. So for them, social prescribing is really, really important. So we've adopted the right place. So we've got some resources to work in the right place. So the right place is simply, if you need help, doesn't matter where you are, someone can take you to where you get help. So it could be, and it is a bloke at the one servo down there, train that person to, if someone comes in and fills up their car with petrol, they might need a bit of help, or just let's take them to that person who can provide that help. It could be the pharmacist, it could be the GP, it could be any of the social groups down there, the community groups. It's about how do you get the community to do that navigating for you? So that's a really big outcome that they're working on. And there's been some movement in the health services space. So there's been some additional GP hours that they've secured. They've negotiated with the Royal Flying Doctor Service for mental health support for young people, podiatry services. So collectively, when both the service providers and the community start talking about things, we're actually seeing change in a way that the community want, which is really powerful. And this probably explains it really well. So this was a report from ABC News about 3 months ago. That works.
Polly Cousins has 7 children, ranging in age from 5 to 20. She needs to make doctor's appointments more often than most.
Myself and all of the kids are neurodivergent, and that means we have to connect with a lot of allied health professionals. There's medication, there's referrals to paediatricians, there's seeing the GP to get NDIS paperwork filled out.
When Miss Cousins and her family moved to Tasmania's Derwent Valley a year ago, she tried to access the GP clinic just minutes from her home.
I was told no wait list, closed books, no hopes of the books opening up anytime soon.
So anytime someone in the family needs a doctor, they face a 2-hour round trip south to their old clinic.
We all still need access to adequate healthcare, and that's what it comes down to. We don't have access to adequate healthcare, and it shouldn't happen in Australia.
But it is happening across the country.
What we find is that we're just so desperately short of GPs. Some of our inner city areas are struggling as well, but especially our rural areas, we are really short. We've just got to try and change a medication.
The Australian Medical Association's Tasmanian President, John Saul, is a GP at several regional practices.
There's about 60 advertised positions across Tasmania. I think we need about 150 new GPs in our areas.
Recent figures show only about 15% of medical students wanted to go into general practice. In the past, it's been around 50%, which means the shortage of doctors is set to drag on. The AMA believes one of the solutions is better pay and conditions to compensate for years of expensive study.
Unfortunately, it's more challenging, more difficult. There's, without the government support, it's just not attracting the younger GPs like it should.
The Tasman Peninsula, despite being a regional area, now has 2 full-time doctors. But for years, the community has had to rely on locums.
There were times when it's been extremely difficult to get an appointment with weeks delay from when people want to see a doctor.
While the GP clinic is better staffed than it used to be, there are shortfalls in other areas. After-hours care is non-existent and mental health support has been lacking. That's where a new community group has come to help.
Yeah, I'm really glad that Maria and Mary can both come today, actually.
Tasman Voice for Health has adopted a kitchen table approach to gather information from the community about its needs.
They ran about 13 kitchen tables. They spoke to over 80 people on the Tasman without any external person present. And it was quite empowering for us to see it roll out.
Welcome everyone to our meeting today.
The group is already tackling some of the big issues.
We've actually got the Royal Flying Doctors Service coming down here now on a fortnightly basis, 3 days a week, to provide mental health counselling for young people, which is really very fabulous.
And they're working on prescribing social solutions to health issues.
We're not just talking about the medical health of someone, but their holistic health.
That could mean recommending an art class like this one at the Eaglehawk Neck Hall for someone experiencing social isolation. There are dance, exercise and other activities held here too.
Every day there's something on and it just brings the community together and just helps mentally as well as physically.
Tasman Voice for Health isn't expecting huge increases in government funding, but it is hoping to have more of a say on how the money is spent.
To me, they're good guys. Every community needs spokespeople to work through the problems that they've got.
And hopefully find ways to make life that bit better for everyone. Fiona Blackwood, ABC News.
So that's the thinking around the Health and Wellbeing Networks. So I won't speak a lot about the Health and Wellbeing Networks. It might be good to have some questions and a bit of a conversation from your perspective. But what we've got is we've got some funding from the government to set up 3 Health and Wellbeing Networks. So in 3 locations, Ulverston, Scottsdale and the Huon, and they're all different for very different reasons, but they're all remote areas in terms of they don't have a primary care facility there. So they're different communities. So Scottsdale, for example, it's a farming community, but that region has some of the highest suicide rates and mental health issues in Australia. So again, looking at what the community can do around that space is really, really important. So the networks, it's the Tasman model, but again, we're doing it slightly different. So this time, instead of us working in the community, we're actually employing people in the community to do that work. So we're actually in the community for 2 years, and they're driving the work, which is really, really important. We want to continue to empower the community, to drive the community to identify issues. So we've set up local mentors in each region, which again, they know the lay of the land and they're working with the staff in the regions. They've rolled out probably 70 odd kitchen tables. They are starting to understand the issues from a community's perspective. And the next step for us is to then take that. We're doing some asset mapping. So we want to understand what the soft infrastructure, the hard infrastructure is around health. We're looking at that from a broad perspective. So it's just not clinical health, it's a whole social determinants of health perspective. And then we enter the co-design work, which will probably happen in about 2 months' time. So there's a few more slides, but it might be worth just pausing. And if there's any questions, I'm happy to do that.
Thank you. I'm Mike Bazell, Brisbane South PHN. I'm particularly intrigued, obviously, with the relationship you have with Phil's lot down there in Tasmania. And I note that the state or the Tasmanian government's funding. Has there been any funding from the Commonwealth through that?
There is. So we're unique in Tasmania. We only have one primary health network, PHT. They fund us a little bit in terms of our core funding, and we work very closely with them. So the Tasman work was done in partnership with them and the health service. With the Health and Wellbeing Networks, we're starting to talk to them about building some of their contacts across the industry, across the GP networks, and how do we bring the service providers across? But yeah, they're key. Tassie's a small place, and they're part of the puzzle. Yep.
Hello, my name is Margaret, and I've been listening to what you're saying about the kitchen table sessions. And mine is not so much a question, but a suggestion that you ask your federal member to actually attend a couple of these kitchen table sessions, not with the same group, but with different groups, and let them listen to what the community is really saying about how they're hurting. Maybe they will see for themselves firsthand where the help is needed, instead of them waiting until I say in election time, to say, oh, we'll promise this. Let them see it firsthand long before an election, and something might happen then.
Yeah, I totally agree. To really influence change, you need everybody on board. So that's the politics, it's the bureaucracy, it's the health services, it's the community services, and it's the community. So you need all those people around the table to really impact positive change. So I guess a careful comment is that, you know, the health system is, you know, it's traditional, it's hierarchical. For us, a lot of the barriers are in the actual health system. The politics get it a little bit. So they get it to the point where they were happy to put $4.5 million on the table for something they didn't actually know what it was going to produce. And one of the hardest things I had to do was, not maybe the hardest, was explain to them, you need to fund something, but I actually don't know what you're funding because we don't know what it is yet because the community haven't told us. And it's a really sick, if you get into that conversation with politics, it's a really tricky one. So I guess credit to the politics in Tasmania, they said, okay, well, we'll trust the community. And they know, you know, the community may have told us to go away. And that's perfectly fine. If that's what the community wanted, we would have gone back saying, hey, it's not going to work there. We'll try somewhere else. So I couldn't hear that properly. No, they're funding a process. So what they're doing is they're funding the community to have conversations about what's important to them around health and wellbeing. They're funding a community. So you just, it's very hard to get the social structures of a community together unless you fund it. And they've also put money on the table so that when the community say, hey, we want this, there's some funding there to actually deliver that as well. So the last thing, so one of our challenges as an organisation is you can work in the community and you can empower the community, but if the system isn't listening, then you're wasting your time. So half our work as a Health Consumers Tasmania is being in the community, and the other half is being in the system and making sure the door stays open. You know, we've only got so many legs, but you stick your leg in the door because it's going to close as soon as you walk away. And then you go and you talk to somewhere else in the system and they go, yeah. And you walk away and the door closes again because they're so busy and they're so traditional in how they work. So for us as an organisation, we have to be on both sides. So I totally understand that the political question is key. And, you know, the politics in Tassie is different to Queensland. And we've got to work around that dynamic, which is quite interesting. One more question.
I'm a health consumer, and I had a really powerful anecdote shared with me from someone in social work in an urban centre, and they said that when they had patients transferred from regional places, that they only got referrals for social work services from regional centres that had a social worker. So people who already have access to a service will get continued access, but when they were dealing with communities where services didn't exist, people didn't even know to ask for them. So how do you pair up the brilliance of communities identifying their needs with the health literacy to know what services or supports might address those needs?
Yeah, that's a really deep question. So how long have we got? It's and I totally understand. It's getting all the balls in line, which is really, really difficult. And I guess that the trouble is that the health system is siloed. So once you start referring people from one part of the silo to the other, there's massive gaps that people fall through. And you know, the social services support is a classic case. And referrals out of hospital is a big issue everywhere, and it is in Tasmania, and there's been some work in that space. So we we're not there yet in terms of that level of sophistication with the right place and the social prescribing bit that I talked about. We'd love to be able to get to that point where, you know, if someone has an issue, they can go and talk to a group and get some peer advice. We think is really important because our research shows that, you know, people go to a GP first to try and get advice. Most people don't have, or a lot of people don't have a GP, so that's out. Pharmacist, yeah, maybe not. Google is third. Family, friends, contacts is fourth, and that's growing. So that's where people get information from. So how do you and educate's the wrong word, but how do you build the collective literacy of a community so that when you are talking to a friend, they can say, hey, you can get some support, but it's just not, you can get support, here's a business card. It's, I can actually take you to where you can get support. So you have that collective healthcare model. I don't know what you call it, but it's everyone looking after everyone. And so for us, that the health literacy bit is making, for us, initially it's getting the service providers knowing what's in the region, because they can't refer if they don't. And then it's getting the community aware of all those sort of things from a service provision perspective. And then it's getting people aware of what impacts on their own health and well-being. You know, maybe you get really stressed when someone says Google something because you don't have a phone. Yeah, there's a whole lot of factors that impact on health and well-being that, and the system looks at it generally from a top down. You're sick, we'll make you better. We'll make you better on this condition because we've found that out in the 15 minutes we have with you, but they don't understand the rest. And community get that, but it's, so for us, it might be maybe a too strong a comment, but we want to use this to reframe how we deliver health. So what I haven't talked about is, okay, we get these networks, we get the communities really empowered, then for us, that's a really strong voice to really change the system from the ground up. How we do health, how we fund health, how GPs operate, we want to influence all that, but we've worked out we can't do that unless the community really push. I haven't really answered your question maybe, but it's a great question. And there's 1 minute, so I'd probably use that minute just to say thank you. So from Health Consumers Tas, it's really great to be here. It's really great to hear the enthusiasm, the commitment that is happening in this space in Queensland. You know, we're making good grounds in Tassie, but we're really envious of the work that you do. Your streets ahead of most other states in how you work consumerism. People hate that word, and I do too. I don't know why I used it, but how you work as a community and as health consumers to shape the system. I think in Queensland, you're doing a tremendous job. So thanks for having us, and we're keen to learn as much as we can.